to join, and then we'll get started. Jama, do you want to pull up the first poll question while everyone's logging in? So we have one poll question just for everybody to answer while you're logging in, and then we'll introduce our speakers and go over the agenda for the workshop, and then we'll get right into it. So. If you could make sure to mute yourself. Presentations are going on.
Oh, hurry, eat it. It's just ice.
You should be able to just either scan the QR code or you go to the website up at the top, theminty.com, and use that code to answer our first poll question. Yes, and Jama just put it in the chat, so you could easily just click on it in the chat as well. Jim, I don't know why it's not showing the answers. I definitely submitted a response. You have a different question, Jill says on the chat.
Great.
Oh. You might have to refresh your screen, Jill. So if you just swipe it down, that's one of our poll questions for the end of the presentation. So I'm not sure why they're all connected.
Sorry about that. Let me get this one pulled up.
Julia's on here.
Right, so we'll leave this poll question run for a little bit longer since took a little while to get the correct one up, but thank you everyone for joining us. We will get started momentarily, and just to remind everybody, make sure to mute yourself. Always, if you have a question, unmute yourself or just put the question in the chat. James and I will be keeping an eye on that chat during the presentation, but I don't know if this poll question is working, James, so maybe we should just get started and go on to the first slide. Oh, yeah. There it is. It's a little bit delayed. I don't know what's going on, but.
Want me to go ahead and go to the agenda?
Awesome. Okay. Thanks all for joining. We had definitely had maybe more than our fair share of technical issues today. The audio in the first Zoom link didn't work, and we've had some issues with these QR codes that we've tested multiple times. But thank you all for joining. This is our third workshop on clinical research recruitment. For those of you that don't know me, I'm Ben Ashalia. I'm the Assistant Vice Chancellor for Clinical Research Operations in the Office of the Vice Chancellor for Research. I oversee the Office of Clinical Research Operations and Services, which was formed in July of last year, so we're still pretty new. It includes CREST, the IND/IDE office, Clinical Research Workforce Development Program, the Novel Clinical Trials Program, and the Clinical Research Recruitment Program, which is the team that's helping to run this meeting today. We have an exciting hour planned for us today with a discussion of diversity, equity, and inclusion and campus resources from the the Office of Diversity, Equity, Inclusion, and Community Engagement, led by Jamil Mallory, who's the Director of Community Data and Strategic Initiatives in that office. And then after Jamil, we have a discussion on community engagement and some best practices, led by Dawn Neese, who's the Director of Community Engagement and Health Equity in the CCTSI, and Montel Temez, who's the Deputy Director of the same group, the Community Engagement and Health Equity group in the CCTSI. Then following that, we'll have time for questions and answers in an open discussion led by Kylie Vanderweiss. Kylie is the program director. She is leading the clinical research recruitment program, and has been an amazing addition to our team. So with that, I will hand it off to Jamil to get started.
Thanks, Ben. Good morning, everyone. I'm Jamil Mallory. As Ben mentioned, I'm the Director of Community Data and Strategic Initiatives with the Office of Diversity, Equity, Inclusion, and Community Engagement. For those of you who might not know, our office is considered the central office for the campus that oversees a lot of the DEI initiatives and activities throughout the campus. So we work with the 6 schools and colleges on our campus, along with our hospital partners and various business units and departments to connect DEI initiatives with the overall strategic plan for the campus. And so that's kind of our job. Our Vice Chancellor is Dr. Regina Richards, that oversees the central office, and we're located in the Chancellor's office also. So today I'll be talking to you briefly and trying to, as much as possible, provide you with as much information as we can, and allow for time for the Q&A afterwards. So today what I'll be talking to you about is how to incorporate DEI into your daily activities, into your work, and also how to utilize resources from the central office. And then lastly, we'll talk about the process for engaging with our office throughout that time frame. So when we're talking about DEI, our statement, a lot of times we are contacted by research teams, typically to help them to work on enhancing diversity within clinical trials. That's typically why people contact us initially. So what we try to do there is actually take a step back, because there's another unit and organization that really is here on our campus to help facilitate that process. But what we want to do is connect with teams in order to actually get them, provide a baseline for DEI, and to help them to start thinking about DEI in a more holistic fashion. And so once we're contacted, typically someone either contacts us via email or they fill out a consultation form, and then we start our journey together. And so one of the first things that we talk about with a lot of research teams is, in addition to trying to diversify subjects in clinical trials, what does the DEI environment look like within your unit and or organization? So our statement a lot of times to teams is, we want you to be proactive versus just performative. And so DEI, really, we know, in health equity, starts from within the organization, from within the teams, from within the community. And so what we help teams to typically do is to take stock and take inventory, and to assess their DEI readiness within their own organization and unit. So some things that we talk with teams about it, and some questions that we typically are asking teams are, what are you currently doing to incorporate DEI into your daily work? And so we start to journal and write those things down. We also ask teams, to ask themselves, are we participating in DEI trainings and education and ongoing opportunities to engage in DEI work? Another question that we ask is, are we working to diversify our research staff? How diverse is our staff? Whether that's research coordinators, whether that's PIs, how diverse are we as a unit or a team? And then we also ask teams to start thinking about, are we collaborating with other units or research teams to learn about innovative approaches in DEI? So those are some of the questions that we're typically engaging with teams about, to really get a holistic understanding of where they're at, and where they plan to go within DEI, and really how to get a gauge of how to incorporate that into their daily work. It looks different for different teams. And so we try to really provide a strong foundation and a support structure in order to support those efforts as they go along, trying to address the clinical trial areas. So in essence, we help teams to develop a DEI strategy. And what that typically looks like is we help to create, help teams to, if they don't already have one, to help them to get started at creating a DEI committee, which does include, we encourage the inclusion of leadership in those committees. That doesn't mean that the PI has to know all the intricate details of the strategy, or, the directors have to know all of those details. It just means that we want them to be involved. We want them to understand that a DEI strategy is needed within the organization and unit, and for them to have a kind of a baseline foundation of what's going on. If at all possible, we want them to be as much involved in that process as possible, but we know that folks are extremely busy and working in both in clinic and have appointments within the school, so that's not always feasible. We also help teams to create an internal mission and vision statement. So we help them to outline and identify, what is their true, where do they see DEI fitting into their organization and unit, and what does that really look like, and what do they aspire to attain within that space? And then we also help teams to take an assessment and identify challenges, typically where we're helping teams to do a SWOT analysis, which is just trying to identify where those strengths lie, where there's opportunities, and what challenges are really that they see within the organization that's going to prevent or inhibit DEI, excuse me, from being implemented into their overall work structure. Excuse me, I'm sorry. And so ultimately, we want to get teams to a place where they could actually develop a DEI strategy, and then not only develop that strategy, but then to move on to taking action. And so we ask teams to start to commit to participating in DEI trainings and education sessions. We ask for a commitment from teams to start making improvements in 1 to 2 core areas, at least 1 to 2 core areas per year. So our statement is, don't try to boil the ocean and do it all at once. But, if you can identify and commit to making some key improvements in 1 or 2 areas, then at least gets momentum started. In addition to that, we ask that teams actually utilize SMART goals and then start setting timelines, and monitor and track their activity along the way in order to assess their progress. So we help with the facilitation of what that process looks like. We utilize different frameworks for different teams in order to do that, because again, not every research team is the same or has the same types of objectives. And then ultimately, we help to connect them with our office in order to develop relationships with other thought partners, other research teams, and other units in order to help to continue to build that momentum and to get a understanding of kind of what's going on throughout the campus as a whole, and to also have some allies within the community. So next slide, Jim. And so some of the services, the core services that we offer as a central office to the campus is DEI education and training through our HEAL lab. We also offer strategies on ways in which to diversify the research workforce through our search advocate program. We have a career in exploration and science exposure unit that actually helps get young adults and kiddos onto the campus to actually explore research and to learn about opportunities from the different public school systems and community colleges in the community that surrounds our campus. We also have our LGBTQ+ hub, which also offers training and education for the LGBTQ+ community. And so research teams can engage with them. We have our educational outreach and career pathway initiatives, which we have two programs. We have a high school program that starts at 9th grade and exposes folks to health science that goes through the 12th grade. And then from there, our other program, UPP, undergraduate pre-health professionals program, picks up from there. And it's just that early exposure of engagement. And this is another strategy that also connects with diversifying the research workforce, because if we're building researchers, early on that are coming from diverse communities, then the more likely chance is we're going to have more success with those types of workforce development initiatives in the future. And then lastly, we have our community engagement arm, which is encompassed by a resident leadership council, which is approximately 25 or so folks that are actively always working on different projects for us. We have our El Abba Cooperative, which is really the place where we connect the work to food. And so we have actual caterers that help to serve from the local community that actually helps to serve our campus with delicious meals and that are there for meetings and things of that nature. We have our supplier diversity initiative, which also talks about our local procurement and places that we're making purchases from. And connecting that with community organizations and businesses. And then we have the new Aurora Wellness Community, and we can provide more information about that organization at a later date. Next slide, Jimmy. So getting a little bit more granular, our HEAL team is really there. This is the Health and Equity in Action Lab. It's really there. We provide campus-wide DEI training and customized trainings to research teams. But ultimately, this is kind of the foundation for getting involved in DEI from a training and educational perspective. So they offer the Foundations in Equity Certificate Program, which is kind of really that baseline. If you haven't really been engaged in DEI, that's a certificate that we encourage folks to actually go after and take to get that foundation. And then from there, the HEAL team is there to do customized trainings and or workshops with research teams in order to just make sure that DEI language is the language that is being written in grants is equitable and understandable. That so they do a plethora of a lot of foundational team building DEI consults. Next slide, Gemma. And then diversifying the research workforce. So this, we have what we call our Search Advocate training program, and it's a research and toolkit for our campus that helps teams to actually start to develop strategies in ways to recruit, retain, and to attain diverse faculty, staff, and researchers. And so there's a tremendous amount of resources within that toolkit that teams can actually start to employ. We also, when folks consult us, we can walk through those processes with teams together, or teams can actually take some of those tools and start to develop some of their own strategies. But we do encourage that we have trained search advocates within our campus that are there to actually sit on search teams. So we encourage folks to utilize those advocates in order to make sure that the search process is actually and the search committee is adhering to equitable guidelines within when they're trying to diversify their research staff. Next slide, Gemma. And then again, as formerly mentioned, we have our LGBTQ+ hub. And the hub is just there to really connect folks intricately with the LGBTQ+ community, both on our campus and outside of our campus within the broader community. This is real helpful for research teams that are working with those particular populations or that aspire to include those populations into clinical trial research. And so connecting with the hub is an awesome resource that our office has for the campus. Next slide, Gemma. And then again, as mentioned, our community engagement arm. We operate a little bit different. We're very connected with the broader community that surrounds our campus, very intricately involved in the Aurora public school system, the community colleges, there are over 170 different languages spoken in the rural public school systems. And so we have our resident leaders that are connected with those school systems. They're also connected with grassroots organizations that are there that are in service to our local community, along with the city municipalities, the fire department, the police department, city council, things of that nature. So really, this is an organization that that is there for the campus to connect with in order to get a better understanding of the community that's outside of our campus, that's on the periphery. And so there's always opportunities to connect, to go to meetings, to really connect with populations that may be included, or you may have aspirations to be to include in clinical trials. But our thing is, we want you to have those relationships already established, versus trying to just get people in trials and then creating those relationships then. So the resident leaders are key to that process. And then next slide, Jema. And so ways to actually connect and engage with our office. So right here, I'm gonna just give you time to, we have our main office email that you can actually utilize. That's how a lot of teams contact us. You can contact me directly through my email, or you can actually schedule a DEI strategy consult. And so, and the links I could actually provide to, I think we actually have those links on another sheet that's going to be provided to you all. But that's the typical way to engage with us. Is typically people are saying, hey, we want to work on this clinical trial thing. Can you help us? Or we want to create a mission and vision statement. Can you help us? And so we're really there just as a central resource. We try to make sure that we take the time to connect research teams with community both on campus and within the broader community, and to make sure that we're all moving together to work towards kind of the same end, again, connecting the objectives, DEI objectives, with the overall strategic plan for the entire campus. So I'm going to shut my mouth now and stop there.
Thank you, Jamil. That was amazing. If anybody has questions, you can start putting them in the chat or write them down. We'll have 20 minutes, 15 to 20 minutes at the end of the next presentation for Q&A. So start sending those in, and I will, I'm looking at the chat and I'll start noting them. But our next presenters are Don Neese and Montel Tamez. So we'll pull their slides up and we'll just get started. Thank you, Jamil.
All right. Thanks, everyone. I'm Don Neese. I'm, as Kylie mentioned, I'm the Director of Community Engagement and Health Equity for the CCTSI. Montel will be covering the second part of this presentation. Just a few words about CCTSI. CCTSI is a NIH-funded infrastructure here on our campus that it's really dedicated to providing support to folks that are engaged in research, clinical research, translational research, and our community engagement and health equity core has been part of that from the beginning. So we've been engaged with this work for about 17 years, we have a lot of resources that are available. I'm not going to spend any time today talking about that. We're going to actually dive into a little bit more conceptual thinking about what community engagement really means. So just to dive into that, community engagement, I think here in the last few years, in a good way, has become something that I think many folks are aware of, folks are really interested in. It's kind of taken on buzzword status, but with that, it has a lot of different meanings to different people. So I want to just dive into how we think about community engagement, how folks that do this on a regular day-to-day basis, particularly as it relates to research, think about it. And so this is a nice sort of working definition that we have here on the slide. The process of working collaboratively with and through groups of people that are affiliated by geographic proximity, special interest, similar situations, to address issues affecting the well-being of those people. And you can kind of boil that down to nothing for us without us is something that I like to use a lot. Next slide, Jema. So we think of this as being a blend of both science and art. So there's a lot of science in here in terms of methods and tools that come out of sociology, political science, cultural anthropology, organizational development, psychology, social work, and also work in community participation. There's broad literature and community-based participatory research as well. But all that sort of then boils down to kind of the art of how do you apply that in your work with a community. And that takes some understanding, skill, and sensitivity to take those scientific concepts and actually put them into action. So I really think of this as a practice of community engagement that blends all of that together. Next slide, please. So we often get asked, community, how do you define community? It seems like it could be anything. And there's a little bit of truth to that. One of the core principles from Barbara Israel and her team that developed the principles around community-based participatory research is that communities self-define. And they could define themselves from a systems perspective. So sometimes we talk about the community here on the Anschutz campus, so that we're part of this system. It could be, a school. It could be related around transportation. Sometimes communities get defined around social things. So could be community organizations, that sort of thing. Certainly geography comes into play here as well. And then there's individual perspectives. So, I am a member of my neighborhood community. I'm a member of my faith community, and I'm a member of my community here at work. So there's a lot of sort of intersectionality in how this gets defined. And as I'll talk about on the next slide, you can go ahead and advance, Jema. When it comes to thinking about this with respect to health and healthcare research and clinical research, we really think about it as for any given topic, do we really have the folks that are affected by that condition represented at the table as we're plotting and planning about how we're going to address that? Does everybody that has a kind of a stake in this, are they at the table? Who's missing? Do we have all the right voices? And are they engaged in a way that they can actually influence decision making? That's really, really important. Next slide. And so we kind of get into this discussion about, on the one hand, community outreach. I think academic institutions have, this is kind of traditionally where we've done a lot of the work in outreach, but we're trying to move things towards actual engagement. So on the outreach side, things may be transactional, maybe short term. They may be related to a specific project that's bounded in time. Community members get engaged around that particular project. There may be focus groups, surveys, those kinds of things. And oftentimes, this is the sort of thing where sometimes the grant's been written and yes, we're going to engage diverse communities, but nobody was really talked to in the process of writing the grant. And then it's, okay, we got to outreach to the community to bring them in. As we move over to more of the engagement side, we're actually talking about long-term relationships. So folks that have been engaged in partnering around improving the health in a community over the long haul. Jamil talked about the Resident Leadership Council. That's been a long-standing relationship of folks really focused on improving the health of the neighborhoods right around our campus. That's a really good example. And, you know, it's an organic process. It creates that space where community members can connect, raise concerns, build power, and also build trust. And that's not always a completely linear process. There's bumps in the road, and those can lead to either deepening of trust, or they can sometimes lead to trust falling away. Engagement activities can include listening sessions, one-on-one meetings, attending community celebrations. We talk a lot about showing up, leadership development, community building projects, and all of that really creates the space where the community can generate the ideas and the approaches and the solutions. And we really try to focus on emergent and long-term outcomes, and that active participation by community members in the work. Next slide, Jema. So another way to think about this is really along a continuum. So outreach over there on the left, moving towards shared leadership over on the right. This is adapted from Australian kind of framework that looks at this. And you can see as we're moving from the left here over to the right, there's more and more community involvement, more and more power that's being shared with the community. And, you know, as we think about this with respect to research, I gave an example of what can sometimes happen on the outreach side with research, but in terms of moving more towards the right side of that continuum, community members would be involved in helping to shape what a project looks like. What are the methods? Okay, we're going to survey community members. Is that something that we're just going to kind of print up stuff and distribute? Or, you know, what about actually engaging community members in the data collection, which also helps to build their capacity as well? And gosh, what's the best way to do that? So those kinds of things actually begin to share power with the community to actually give them a voice in not just what the topic is that's being studied, but also how it's being studied, which can have a great influence on the answers that you get. Next slide. So just a slide here about the principles of community engagement. If you can go ahead and advance, Jema. And this comes from the CDC's textbook on community engagement, which is actually in the process of being revised. Hopefully will be released before the end of the year, but it's freely available on the CDC website. I really encourage you to check it out. But just some basic principles here. Number one, being clear about your purposes and your goals of what you're trying to do. When you go into community, they're going to ask you. So, you know, think about this up front. Is this a time-limited sort of thing? Are you looking for a long-term engagement? Secondly, try to understand the community's culture, what's going on in the community. And oftentimes, that's something where some of our resources that we have in the CCTSI Community Engagement and Health Equity Core can be helpful, specifically our community research liaisons. These folks are embedded in their communities, and they can act as a guide to help you understand, okay, what's the history, what's the culture, what is this community valued and worked on traditionally, where are the potential pitfalls, things that you can hopefully avoid, and that can be incredibly helpful. Thirdly, show up, go to the community, hang out, establish relationships, build that trust. That is so, so important. People pay attention if you keep showing up in their community, even when the grant funding runs out. That speaks volumes. Number four, remembering and accepting that, you know, this notion of self-determination, again, this has to do with ceding power. That's a responsibility and a right of everybody in the community. It's not something that we bestow, you know, from the ivory tower of the campus, but it's there. And working with that, building that capacity is really, really key. Partnering with communities necessary to create change and improve health. Number 6, all aspects of community engagement should recognize and respect the diversity of the community. This is where the DEI training and work, that introspectional work that Jamil was talking about is so important. For you to understand where your own blind spots are, understand where you have places to grow in your understanding and appreciation, super, super important. And getting to know what those, again, what those cultures and values are that are impacting a community and related to diversity are really, really important. Number 7, community engagement is sustained by identifying and mobilizing those community assets and strengths. This is really, really important. You know, oftentimes when we're entering a community, particularly if we're interested in equity work, you know, we're aware of the deficiencies, we're aware of the deficits, but oftentimes we're not aware of the assets and strengths. And so making it your job to uncover what those are and have as deep a knowledge about those as you may have about, you know, where things may be lacking, that sort of thing is really, really important. Number 8, you have to be prepared to give up some control. One of my favorite questions to ask people when they're presenting community engaged research is, how did things change as a result of your engagement? Did the project plan change? Did the way that you were doing things change? Because if it didn't, you probably weren't authentically engaged. Finally, that's long-term commitment. That's really important. Making sure that folks know that you're going to be there, not just for this today, this particular project, but you've got a long-term commitment. That goes a long way. Next slide. And I think Montel's going to pick up here.
Yep, we can advance to the next slide. Thanks, Jim. So, you know, Dawn mentioned the importance and the foundational aspect of the DEI work that Jamil presented on earlier, and how important it is to doing this work. So when you're, you know, thinking about community partnerships and community engagement in the context of research, it's easy to get kind of lost in the weeds of, okay, how do I do it? And why am I doing it? And one of the things that I try to constantly remind myself about is, you know, part of the purpose of engaging communities in research is so that we can ensure that all of our communities are benefiting in an equitable way from the health research that we do. And traditionally, that hasn't been the case. And this is because of the systems that we work in. And so it's hard to work within the systems. And I understand that there are lots of roadblocks, lots of administrative challenges, lots of time challenges and funding challenges and things that come up when you're trying to do this work. And that's why, you know, if you're struggling, reaching out to Jamil or reaching out to Dawn and I, we can really help try and you know, strategize with you around how to overcome some of the barriers that you will encounter as you're, you know, doing this work. When we're talking about developing partnerships specifically with diverse communities, it's helpful to have folks who already have some relationships if you don't. And so that's, again, where this infrastructure for community engagement and DEI can really be helpful. You know, we really focus on trying to maintain a diverse group of partners, including those who are directly affected by lots of different health issues. So, for example, if you're working in osteoarthritis, you know, maintaining relationships with folks who in the community, you know, are experiencing those issues is really important. Cultivating relationships with organizations might be a good place to start. You might graduate to having a group, a wide network of individuals that you work with, but sometimes it's easier to begin working within community-based organizations. And it's helpful if you already have somebody who has a history of working with that organization, who's spent some time building trust, who can provide a warm handoff and maybe even support you in your initial engagement with that organization is really important. And there's a lot of resources on campus for assistance with that. We want to make sure that we are always respectful of the organization and their mission, and that we are meeting them where they are, as opposed to trying to get them to come to us. And that's that outreach versus engagement piece. We usually want to start with a small number of diverse partner organizations. It can get really unwieldy, and we know this from experience working with lots of organizations. Everybody comes with their own lens and their own priorities, and having to sort of negotiate all of that can be a little bit challenging, but it can be done. And again, there's a skill set that's available to you to help with that. And we also think about, who represents the community. And that's why we tend to maybe gravitate a little bit toward organizations in some senses, because it's really difficult for one organization or one person to really represent a specific subpopulation. We don't want to tokenize people, I think is the key there. We want to make sure that if we are engaging folks, we're doing it in a meaningful way based on their lived experience. That's particularly helpful when we're designing research studies, where there are human subjects involved or human participants involved. They can really help us think through a dynamic and respectful and engaging protocol that will help efforts to recruit a diverse group of people into the study, and also hopefully help keep them and retain their interest. We also want to recognize that our partners can wear multiple hats, and Dawn sort of alluded to that when we're talking about how we define community. People have multiple roles, and they're members of multiple communities, and it's dynamic and ever-changing. And because of that, people have a lot of commitments. So when we're engaging our community partners, we do a lot of things after hours. We do a lot of things after the grant money runs out. We still show up in community. We try to attend to those relationships just like we would personal relationships in our own lives. Go ahead, next slide. Thank you. And this is where we really start to get into some of the DEIA work. Cultural competency is sort of been held out there as the destination for a lot of DEIA work. And I think, in recent years, especially, we've realized that's not enough. It really isn't enough. We have to push beyond cultural competency. We have to push beyond the checkbox. We have to push beyond that one training where we define terms and, all have a common language that we're using around DEIA work. And we really start to want to move beyond that to focus on meaning and constructs and self-reflection and cultural humility. I think is probably a better outcome there that we would want to hope for when we're working with communities that we're not a part of. We want to avoid stereotyping people, and I think that sometimes that's where we end up with cultural competence. But if we're not actually engaging in self-reflection around our own biases and how we interact with communities personally, we tend to do the community a disservice, and we're actually not building functional, meaningful, engaging relationships that way. We don't want to reproduce repressive patterns within our partnerships. And again, that's a level of work and training and assistance that Jamil's group can really help with as well, providing some training around what does that mean in practice. We are all, pretty adept, I think, academically and understand intellectually what a lot of these concepts mean. But when we're actually in practice, when we're recruiting people, when we're doing a research study, when we're engaging with community partners, when things get difficult, when relationships need negotiation and crucial and critical conversations and difficult things are happening, this is where this work really comes in, and where you start to notice on your team where you have work to do. And as that stuff comes up, there, like I said, there are resources within the CCTSI and ODICE that can really help you navigate this stuff. Next slide. Once you're sort of in the relationship and in the partnership and in practice, we focus a lot of time and attention on what we kind of call the glue that holds the partnership together. And this isn't a one-way deal. This is a reciprocal, this is iterative, this is a two-way street that happens when we really start to look at power and where we negotiate power imbalances. And we have to be willing to cede power to our community partner and share it, and come up with, strategies, policies and agreements that don't just benefit us as the researcher, and that really center the meaning for the community. What are they getting out of this? What are our community partners? What are our research participants getting out of this interaction with us? It's not just about us going in and extracting information, but how do we return that? How do we negotiate a partnership that works for everyone? And so when we talk about glue, we're talking a lot about how do we maintain trust? How do we maintain communication on a daily basis? Do we have somebody on our team who is dedicated to maintaining communication with our research partners and participants? Do we have somebody who has had some DEIA training, who's maybe even part of that community? Do we have them engaged to interact with people and understand, the barriers that they might be coming across as they try to participate? Do we have a way to address those concerns in a way that's meaningful and actually helpful? That, yes, allows us to still do our project, but also allows meaningful participation from the community partners. Do we have processes and infrastructure and policies that really are fair, that are open, that are transparent? Are we engaging people in our planning in a way that's meaningful? Dawn mentioned a lot of times it's kind of an afterthought into engaging, and a lot of times people don't really think about that until the recruitment efforts are failing. And so that's unfortunate, but we have, again, lots of resources to help you think through that ahead of time, so that it saves you time, it saves you effort, it saves you money, and hopefully it saves some relationships in the process. Next slide, please. And so, some examples of how you can work to create the glue in your own partnerships and in your interactions, even if it's with individual folks that you might be consenting or following up with on a regular basis. If you're working with organizations, again, coming up with data sharing agreements, coming up with memorandums of understanding for how you're going to interact with community partners, and what are you bringing to the table and what are they bringing to the table, to make sure that there's an equitable exchange of energy and information and time and resources. So we don't want to forget about the monetary resources. It's important to budget for things like this. In some instances, things, the MOUs and the data sharing agreements and agreements around disseminating the information that you gather from your research back into the community. These are all things that you can sort of talk about ahead of time. And sometimes the PI or your project director might be able to come in with a template and say, hey, this is kind of what we're thinking. This is our vision of how we're going to work together. But a more meaningful way to do that is to actually do that together as a group, as a partnership, if possible, so that everybody feels engaged and represented, and there's buy-in on all levels. Another important piece is that Dawn mentioned that there's a continuum of engagement. There's a continuum around cultural humility and cultural competency. That's all on a continuum. And our partnerships and engagement work actually exists on a continuum. And you're going to have some community partners and some individuals who only want to be engaged with you at a certain level, and that's okay. So, our guidelines and our partnerships and our agreements should really allow for the degree of collaboration that makes most sense to your community partner. I'm going to give you an example. We have a pilot grant program that funds community academic research partnerships. And we have partnership development awards that actually, fund partnership development activities. So meetings and food and childcare and time to come together and mileage for community partners and babysitting and things like that, so that you can engage people and gather them in a way where you have time to talk with folks about what are our shared research interests, and if we were to work together, what might that look like? Then those grants will can sort of develop into what we call a joint pilot award. And that's a real pilot project where you're doing research, gathering pilot data, you're in a community academic research partnership. We typically ask that 50% of that funding for that award goes to the community partner. Sometimes the community partner doesn't want that. Sometimes they don't want to deal with grant administration. They want to do what they do best, and that is work in the community. So we have to be sensitive to what their needs and capacity is. We also have to be sensitive to wanting to help to provide capacity building for grants management and administration. So that becomes a real negotiation with the partner that respects the level of engagement that they want. And that also helps us keep our word to the community. So these are all things that you need to be sort of constantly negotiating as you're working with your partnerships. These change, they're dynamic. It doesn't get set in stone just once. These are things that we revisit periodically during the partnership. Next slide, and I think this actually might be it. So that's a lot to say that it's complex work, it's dynamic work, it's very rewarding. It can also be there's a lot of emotional labor that goes into this work on both sides. And you're in doing this work, you're not alone. There's lots of resources here, and we're always available to help be thought partners and to make connections with you and for you, and to help you as you sort of go along on this journey. So I'm there.
Thank you, Dawn and Montel. Great presentation. We did have a couple questions come in the chat, so I'm just going to read the first one. It is from Deborah. She says, if the ORS team wants to help with a DEI mission and vision statement and making DEI plan for recruiting our own team and outside our team in the research committee and at partner events, is the best next step scheduling a DEI strategy consultation?
Yeah, I'll take that, Kylie. I would say yes, that would be the first step. And I wanted to also mention that there's a kind of a clear distinction. I think that question encompasses two potential processes. So the answer to the first part of the question is yes, we can definitely help the ORS team to develop a mission and vision statement and a basic DEI strategy. And then as you're getting more into, if you have a project in mind, a research, a trial that you want to get more intricate with, then we will connect you with CCTSI specifically to really start to dig into the research aspect of the work that you're planning to do. So we're definitely there to help teams to get started.
Awesome. Thank you, Jamil. So the next question that came in is from Richard. And Gina, why don't you pull up one of the poll questions as I'm reading this, and other people can start answering those. But Richard said, great presentation today on both DEI and community engagement. How can the university better support the development of a variety of community advisory boards that have been set up, such as the Neurology Department Community Advisory Board and the Aurora Wellness Community Advisory Board?
Yeah, I'll start with that. And Richard, it's a great question. I think this is a part of research infrastructure that I think traditionally has been overlooked. And if you look at the flows of indirect cost recovery dollars, those kinds of things, they've not traditionally flowed towards supporting this kind of infrastructure. I think that our campus office of research is interested in kind of thinking about ways that we could bolster that support. But just as an example, we preach all the time that folks who are joining advisory boards should be paid as consultants. They're actually devoting their time, their expertise to the benefit of the work and should be equitably compensated for that. That requires dollars, that requires processes that can facilitate that. And we're, along with folks in Jamil's office and the research office, we're kind of hard at work at thinking about how we can put those kinds of things in place.
I'll just add to that. We do have, like I said, our community, and this might not be answering your question completely, but if you're really interested in pulling together a community advisory board and need some technical assistance around how to develop one, who to look for, how to reach out to people, how to facilitate a community advisory board, what to do with them once you have them, we can certainly provide some consultation around that as well. So to the extent that you're ready to move forward or think you might be, certainly reach out and we're happy to help with that.
Awesome, thank you. So we have a two-part question from Jess. So I'm just going to summarize the question. So she's helping with a 12-month longitudinal RCT with vulnerable pediatric population at COCH or CHCO. A lot of the participants are vulnerable, low resource backgrounds, eager for some kind of help. And she is wondering, how can we design a provider patient-focused longitudinal research project that incorporates building community? For example, our families often approach us as the experts on managing their child care, as well as navigating the different logistical parts of the care and of the study. So how can we work with them?
Yeah, Jess, that sounds like it would be a great, we'd love to do a consultation with you on how to actually approach that. I think it could be something that could be built into a partnership development grant, which Montel talked about, but I really appreciate, what you're talking about in terms of building the capacity and really the strengths within those folks to begin to offer peer support and those kinds of things. And yes, there are ways to do that. And there are ways to also kind of design the study so that you can facilitate that. And there are ways to kind of structure things within human subjects participation and training that will permit that sort of thing. So I'd love to talk more with you about that.
Yeah, and that you kind of hit on her second part of that question, Don. How can we design medical research studies to facilitate that inter-participant relationships given HIPAA laws and other confidentiality requirements and agreements? So I think, Jess, I don't want to speak for Don and Montel, but I know that they'd be happy to chat with you. And so if you want to reach out to them directly, I think that'd be your best next step. Then we had one more final question coming through the chat from Erin. She said, we have had a couple of questions from patients related to whether stipends from research participation would impact assessment of their income and their ability to receive their Social Security or disability benefits. There are exceptions to income assessment on research participation for Social Security for some rare diseases, but it's very difficult to understand. When we have asked around about what to tell these folks, we have been told that they should consult with their tax professionals, which is a pretty callous thing to tell someone struggling with managing a fixed income. Are there any consultation services available for patients with questions like this so they are not excluded? Or can you speak to a better way to message this?
Yeah, I can. Oh, and it looks like there's also someone in the chat that might have some experience with this. Yeah, we actually deal with this a lot. And this is one of those administrative barriers that makes it really difficult to engage people, not only as participants in research, but as partners, and to provide compensation. And, one thing to keep in mind is that, there are IRS guidelines around the amount. I think it's, $500 in a calendar year, and anything below that isn't going to be reported to the IRS, and so probably wouldn't impact their ability to collect their Social Security or other pension income. But it's something that, if you can train the folks who are doing the consenting, and in, having that first contact with participants to really open up that conversation and say that these are potential implications. And it looks like there are some resources also being shared in the chat, that, you know, that's definitely something you can train folks to have conversations about. I'm not aware of any campus-wide resource for patients or for people who are participating, at least in my experience, that focuses solely on that. Dawn, Jamil, I'm not sure if you know of anything else.
No, unfortunately, no.
Yeah.
Well, thank you for that information, Montel. I think that's definitely something that the clinical research recruitment program can look more into, whether there is additional resources that we can put together. Lori did put in the chat that it's reportable for payments of $600 or more during a calendar year. So we are at time. We did put together an infographic like Jamil mentioned earlier in his presentation with all of this information and links to these different services that we'll send out with the presentation. This was recorded as well, so we'll send out the link to the recording to all individuals that were registered and attended, and it will be put on the clinical research recruitment program website, so you guys can all reference it at a later point as well. Awesome. Well, thank you, everybody. This was wonderful. Thank you to our presenters. We greatly appreciate your time and your expertise and your guidance as we're hoping to expand DEI and community engagement across the campus. Have a wonderful day, everyone.
Thanks, everyone.